Demonstrate an excisional biopsy of a suspicious cancerous lesion. This is obviously a demonstration on a chicken leg, but the principles are the same. So you'd want to go ahead and measure the actual lesion itself before you do anything else. This lesion measures about 1.2 centimeters by approximately 1.1 centimeters. Now, the amount of margin you would want to take may vary depending on what you suspect the cancerous lesion is and then depending on where it is on the body. Margins are different on the face versus other sites on the body. But for demonstration purposes here, we're just going to go ahead and take a sizable margin. Just to show, we're going to go ahead and take a 1/2 centimeter margin from each side. There's a 1/2 centimeter there. There would be a 1/2 centimeter over here. Just kind of maybe making 4 points to get all of the margins. And then we basically connect the dots in an elliptical fashion to excise our lesion here. So we'd want to do it elliptical based on the stress lines of the body and really go ahead and get a healthy margin. The number one thing is to make sure all your margins are clear, and then we'd want to go down as well when we do this. The best blade to use is actually a 15 blade. I only have a 10 blade here to demonstrate with. It should suffice for demonstration purposes. Whenever we use a scalpel, we want to go ahead and use tension. It makes the incision process much easier. So we will go ahead and make the initial incision here. And we want to make a smooth stroke when we're incising tissue. And we want to just connect the lines. Sometimes you can do it all in one swoop, a little bit more of an advanced technique, or you can do it in a piecemeal fashion like I did there. Once you have a wound edge here, you want to go ahead and not crush the tissue, but pick it up a little bit. And then you would go ahead and get your wound edges completely excised here. And once you have that, we want to go ahead and get down to the fat. So we'd want to hold that up. You're going to have fascia and fat there, and you're going to want to go a little bit deeper there. And if it's a pretty big excision, you may also need to use electrocautery. You'll see significant bleeding. And then you want to go down and get deep under the dermis to the actual subcutaneous fat if you really suspect a heavy cancerous lesion. And this is what you would do if you're doing it an excision in an office or there. Now you can see the tip here has not been excised well. And then you would, of course, grab your tissue and go all the way across and excise tissue. And we would make sure that we would send this tissue to pathology to have it examined and make sure you have clear margins. If it turns out to be a cancerous lesion and you don't have all of the margins, then you will obviously need to do a second procedure to clear the remaining margins. And that does happen on occasion, but if you do get healthy margins, that shouldn't happen. And then once you have a lesion such as this, you'll want to go ahead and suture it closed. You may do 2 layers or a 1-layer approach. You may do a subcuticular closure or actual skin sutures that are interrupted. And then you probably, the way you would close this, and this is obviously a chicken thigh, you'd want to go along the lines of tension, your Langerhans line. And then this is the tissue that was excised. Thank you very much. I'm Dr. Bardia Anvar from Skilled Wound Care.